Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, you have an interesting case study to share with us today.
Right.
A patient that you saw.
Yes. Well, let's get on with it. He was a 67-year-old male, and this happened just in March. He had surgery on his neck between C7 and T1. Okay, there were some problems with nerve entrapment, and they took care of that. The pain down his arm was immediately gone after surgery. 6 weeks later, he's still working full-time at a sawmill, actually, aggressive, a very fit person for his age. Continued to have pain in his right shoulder and neck anytime he got above shoulder level with his hand, which was interfering with his work. So by the end of the day, work was not very fun. So the doctor gave him a prescription for therapy, and why don't you have a seat here, Bob?
Do you know where his pain levels were at? Do you remember?
I did not get a number as far as pain numbers, but he was taking 3 ibuprofen per day.
So it was bad enough.
Yeah, for this. Yeah. And he's the type of person that he doesn't like to take pills. So that was part of the reason he wanted to get off of this, so he could work better and get off of these ibuprofen. So this is, I put a mark on Bob right where his incision was for the surgery. It was right here, and when I touched it and I moved it, it was very clear there was a lot of scar tissue there. Like here, you can feel soft skin, but if you have an incision, you push here in an area about the size of a 50-cent piece would move all together. And you know what I'm talking about. It was all
scarred down.
Yeah, it was all scarred down. Well, we got to work on this. So I just start working it with my fingers a little bit, and it's like, well, we've got to get something a little more effective. So I got the Pure Wave massager here, and I put the
attachment with the pointer.
Yep, with the point stick on her, they call that, which is really nice because I could get really specific on it. So I turned it up as high as I could go.
And you said you went through the clothing?
Well, first, I wanted to get right around the incision, and I went over it as tolerated. I stayed away from the spinous process or the bone here because that would be very uncomfortable. And yeah, this, if you go directly on the skin, it kind of sticks with this head.
Yeah, it can kind of pull and tears.
But all you need to do is get over here.
Yeah, that feels really good.
And it feels better, and now I can slide across the skin. And I got pretty aggressive with it.
Actually, that feels really good.
Okay. And that's his response was, he didn't say it felt really good because it was working with that scar tissue, and I just continued to work it until he said it felt numb because he didn't have pain, but at first it was just okay. But then finally he said, yeah, it feels numb. And that's when I knew it was time to stop. I wasn't doing it for real long. It was only about 3 minutes or so. But I got the response that I was looking for. Okay, the next thing I had him do going home is, where's the TheraBand? I just had him take a TheraBand and do some flexion as high as he could that was tolerated. Okay, so he started out low and he worked it gradually up. Okay, and then I also had him do some flexion and pull-ups. That's what it was. So here, and he was just pulling up because I wanted to get those upper traps working. And that was it. And I had him go home, and the second visit he came to see me the next week, he said within 2 days after that first treatment, 75% of his pain was gone. He felt much better at work. He was down to 1 ibuprofen today, and I actually didn't even treat him that day. He was very satisfied with it. And
I think that's what I've seen, Brad, historically. A lot of times it's amazing how much that scar tissue can cause pain.
Right.
So if you've had surgery and an injury to an area, there can be scar. Even if you haven't had surgery, sometimes there's scar tissue in the muscle from the injury.
Right,
from a torn muscle.
Yeah, we do get a lot of feedback on our cross-friction massages.
Right.
And so, if your fingers are getting tired and sore, this is a great
the Pure
tool.
Wave is a good alternative. We use these in our clinics all the time now. In fact, it was interesting. I had one therapist substitute at our clinic, and they said, where do we get one of these? And so we had to make sure we sent one along with them too, because they were using it all the time. Patients love it, the clinicians love it, and you'd love it too. We'll put a link down below if you want to buy one.
Exactly.
So, all right, thanks for watching.